Digital transformation is happening whether you're ready or not. COVID-19 has placed various remote care technologies at the forefront of care delivery. The rapid adoption of telehealth by patients and new reimbursement models are driving physician support that just a year ago were met with tremendous resistance. Now, Terrie, we've discussed this. You had some apprehension towards the adoption of telehealth. What changed and why do you believe that telehealth is indeed the embodiment of personalization?
You know, Glenn, I truly believe that the realization of telehealth's utility is one of the many silver linings of this devastating pandemic. I say that because we have some significant medical crises, both nationally and globally, that existed long before COVID and are going to require a totally different way of thinking about the delivery of medical care. When I connect with my patient virtually, I am collecting more information about her living and working conditions than I ever could in a traditional office setting. That is why I say that telehealth is the embodiment of personalization. It is the actual personalization of the care delivery model that has revealed the limitations of that traditional standardized medical office visit.
So, Bob, we have a question here. What do you believe, or where do you believe, or why do you believe there was resistance to virtual care pre-COVID, and why did adoption accelerate during COVID-19?
The fact is that, physicians and patients have traditionally had all their encounters face-to-face. So there's a mindset shift required to go down the virtual care path. That's the first initial resistance. The second part is this reaction that, well, this can't be as good as face-to-face. Patients want to see the docs want to see the patients, and face-to-face in a physical room. Not realizing that a lot of what telehealth brings to the table is supplemental and augmentation of care. It's not a replacement for traditional care, but it absolutely adds tremendous value on top of it. And then on top of that, I think there was really just a lack of awareness of the consumer demand and desire. The initial knee-jerk reaction is, well, this is just millennials and Gen Xers and Gen Zs. They just want a quick, easy. They don't want to come in and get the medication. They just want to do it on the phone and do it nice and easy. And it's anything but that. With COVID, now what it's turned into is just a simple matter of fact that people don't want to die.
Rich, how do you create the conditions for a successful implementation of digital transformation?
Generally, the critical focus areas for success are focused on people, choosing the right tools and the platforms, and training. You have to develop your executive staff as well as your team and make them into digital believers.
So, Dan, how do we move from analog to digital?
So what digital health companies like Hinge Health can do is we could use technology to essentially take those best practice care guidelines and use technology to better deliver them more efficiently, and particularly care treatment plans that are otherwise quite onerous to deliver. So if you imagine prescribing somebody physical therapy for multiple months, they've got to find a babysitter, they've got to sit in traffic, they've got to take some time off of work, they probably have to pay a copay. It can be remarkably onerous for a lot of individuals. And if we think about other workers, say if you're a retail worker at Walmart or if you're a school teacher, it's sometimes not as easy to take a half day off work. And paying that copay could actually be a very meaningful impact on your budget. And so these all have an impact on whether people will be adherent to the plan. But digital health companies could use technology to better deliver that evidence base. So we could also very rapidly iterate on how the care is delivered to improve adherence. And that's really critical.